Assalamu alaikum. In this session, our objective will cover the urine formation and how it is formed. So we will come to the formation of urine. In the last session, we took the nephron and the blood supply to the nephron and how the blood is going. Now we will come to the formation of urine in our kidney. So again, our main concern is with the nephron for the urine formation. So again, what is this artery, what we call it? This one? What we call it? This part of artery? Huh? The afferent arteriole. So this is the afferent arteriole. And this one? The efferent. So the blood is coming through the afferent arterioles, afferent artery. Then inside here, the capillaries are there, a bit of capillaries. In the glomerulus, this is the glomerulus. So the glomerulus is full of blood vessels. And this is the efferent arterioles, our artery. Where is the filtration occur? In which part the filtration will occur? In the glomerulus. So the filtration, it is occurred here. So in this part, the filtration, it is non-selective. What we mean by non-selective? What we mean by non-selective here? So, yes, so it is not specified. So it is for all depend upon the pressure here. So according to the pressure, when the pressure is high, it means that many substances, it will come out. So more substances are coming out from the blood fluids to the capsule here. It will be filtrated out. So it depends upon the pressure there. So according to the pressure, when the pressure is higher, it means that the filtrate, it will include something. If the pressure is very high, the filtrate, it might include something that it should not be there, or large molecules. But usually the smaller molecules are there. So what are the things which is coming out here? So water and solute, smaller than the protein, are forced through the capillaries. I thought it's my phone. So water and solutes smaller than protein are forced out of the capillaries. So the protein, it will not come out in a normal kidney. The protein, it will not come out with the filtrate in the normal kidney. It will come out in a certain disease like nephrotic syndrome. But in normal kidney, the protein, it is not coming out through the filtrate because it is of a larger molecule. So water and the solute, which is smaller than protein, are forced through the capillaries wall into the Bowman capsule. It will be forced through due to what? It is forced. What is the force that exerted on it? It is the pressure. So it is the high pressure. Thank you. So due to the pressure, the solute, it will, and water, it will come out in the Bowman capsule. Then blood cell protein cannot pass out through the capillary. This is normal. So normally the blood cell will not pass out. The blood, it can also, in case of some diseases. But in case of cancer, sometimes you will find urine, you will find blood in the urine, blood cells. But in normally, the blood cells, they will be intact. They will be inside the blood vessel. They will not go out of the blood vessels. So the filtrate which is coming out, see, the filtrate which is coming out, it will go to the Bowman, collected in the Bowman capsule or Bowman glomerula here in the glomerulus capsule, and leave via the renal tubules, those tubules, which is the distal convoluted tubules. So here you see that water is there, some electrolytes also are there, and also if you see glucose also, it might be there. Normally, is the glucose coming out in the with the urine? So normally the glucose, it will not pass out with the urine. So this part of glucose, if it is there, it will be reabsorbed. No. You know, we know that in case of diabetes, when the blood sugar is high, yes, the glucose, it might come out if the blood sugar is more than what we call the renal threshold. Renal threshold, which is the step or the level that the kidney can tolerate, which is around 170 milligram per deciliter in the blood. When the blood sugar is within this level, the glucose, it will not pass through the urine. But if it is more, in this case, we might find the glucose in the urine. We call it the glucosuria in case of diabetes mellitus. So here there will be reabsorption. We said, if you remember, when we show you the blood supply in the kidney and in the nephron, how the venules are going around the proximal convoluted tubule and lobe of Henle and the distal convoluted tubules, we said that this is for a purpose. The purpose of that, it is for reabsorption. So here the concentration is high. Here was the concentration is high and the pressure is high. So, but mainly the urine is formed through the pressure. The filtration is occurred due to the high pressure. So it is coming out due to the pressure. Now, the blood which is coming in the efferent artery, it has low concentration of all of those substances. Because of that, there will be a reabsorption of selective reabsorption of some of them. So the pretubular capillaries reabsorb several material from that. Some of water will be reabsorbed again, and also glucose, it will be reabsorbed, because we said that the glucose when it is within the normal level, it will not pass through the urine. Also, some of amino acid, which is needed, it will be again reabsorbed. Some ions, sodium, potassium, some of those ions, might be reabsorbed. Some reabsorption is passive, and some of them are active. So either passive reabsorption or active reabsorption will be there. Most reabsorption occur in the proximal convoluted tubule. So most of the absorption, it is occur in the proximal convoluted tubules. It will reabsorb those substances. So the glucose, the water, it will be reabsorbed from there. So again, the purpose of this linked tubules and the blood supply and the capillaries that are there around them is for the process of reabsorption. Then secretion, some material move from the pretubular capillaries into the renal tubules. It will be going to the renal tubules, like hydrogen ions. It will go out in order to maintain hydrogen ion, in order to maintain the acidity, the acid-base balance. So in order to maintain the acid-base balance within our body. What is the pH of our blood? What's the normal pH of our blood? 7.35 to 7.45. So one of the maintenance of the pH, it is through the excretion of hydrogen with the urine. Normally, the urine is acidic or alkaline? Huh? Acidic, yes. So normally the urine is acidic due to presence of hydrogen, which is excreted through the urine, with the urine. So potassium also, potassium ion will be excreted. Creatinine, which is the end product of protein metabolism. Material left in the renal tubules move toward the ureter. So it will move toward the ureter and it will move out. So this is the Baumann capsule here, filtration occur here, reabsorption, and here also on lupulin there are some reabsorption. It will go then to collecting tubules and then to the renal pelvis and to the ureter. So this is the blood. So the filtrate, as we said, water, salt, bicarbonate, hydrogen, urea, glucose, amino acid, and also some drugs that we have. About the amount of filtrate in each day, it is very high. So in each day, around 180 liters per day. The amount of blood is 6 liters. So it means that how many times the fluid of our body, it will go out and coming back. So this is the filtration per day, but mostly it will be reabsorbed. The urine output, the renal output, it is around 1.5 liters per day. So from the filtrate of 180 liters, only 1.5 liters are coming out from outside of our body. It depends upon also the water intake and our fluid intake that we are taking. When we are taking more fluid, in this case, we might pass more urine. If we are taking less fluid, in this case, the kidney will start to concentrate the filtrate more and reabsorb more water in order to maintain the normal level or normal amount of blood in our body in order to prevent dehydration. And this process, it will last for a period of time. But if we are not taking for a long period of time, we are not taking water, in this case we will go in dehydration. So reabsorption here, it shows this is the active reabsorption and this is the passive reabsorption, transport or secretion. Active transport is there. So the sodium chloride will be reabsorbed, which is the active transport. It will be there in the proximal convoluted tubules, and here also. So reabsorption of sodium, it can happen in the proximal convoluted tubules and lobe of Henle, and also the distal convoluted tubule, which is the last step. Even in the collecting tubules. Water, mostly it is reabsorbed in the loop of Henle and in the also collecting tubules and proximal convoluted tubules. Bicarbonate, also it is reabsorbed in the proximal convoluted tubules and distal convoluted tubules. Glucose and amino acid, mostly they are reabsorbed. If they are coming there, they are absorbed in the proximal convoluted tubules. So the first thing that they will be reabsorbed in order also to maintain the osmolarity of the blood, because one of the function of the amino acid and protein is for osmolarity. Hydrogen, it can also reabsorb here, and also some poisons might reabsorb. So, and some drug it might poison it might refiltrated and coming in, and some drugs also are poisonous. Now we will come to the characteristic of urine. The color of urine usually is yellowish in color. This is the normal color of the normal urine. But the color, it might be changed according to dilution. So the color, it's reflect the component of the urine in relation to water and the concentration of those substances in relation to amount of water which is there in the urine. So the yellowish color, it is due to the pigment of urochrome, which is from the destruction of the hemoglobin. You know that the red blood cells lifespan is how many days? 120 days. So 120 days. After that, what will happen to it? It will be destructed to heme and globulin. Then, in order to use it for reforming of new cells, and some of the material will be excreted. So, from the destruction of hemoglobin, as we said, and solute or diluted urine is a pale straw color. If the urine is diluted, if we are taking more fluid, the color, it will be straw color, straw قشة. Some food also, it might alter the color of the urine. Some food, you know, our food also, it is, we are taking many food and it is colorful. There are different type of color in our food. So those dyes, which is normal dyes, which is present there, it might affect also the color of the urine. So when you see any change in your urine, before thinking of that you are sick or having something, refer back to what you ate during that day. It might be affected by the color of the food that we are taking. Or if we are adding also some dyes, some artificial dyes that we are adding it to our food sometimes, also it might appear there in our urine. Is there usually microorganism will be there in the urine, or is it a sterile fluid? Huh? Normally, is it? Sterile, yes. So the urine is sterile. It means that there is no microorganism in our urine. Unless if we have infection. Infection, طبعا there are, the infection, it might come either the microorganism through the blood, or it might be ascending infection through the urethra. So in this case, microorganism will be there. And also we have one defense mechanism in the urine or in the urinalysis. What is the defense mechanism here? Which is the non-specific defense mechanism, if you remember. What is the non-specific defense mechanism which is there in our urine that protect our urinary system from multiplication of a microorganism? Huh? I am hearing something, but raise your voice. Acidity, yes. Why you are reluctant? So thank you. It is the acidity. The acid which is there, it will destroy the wall of the bacteria and the cell wall of the bacteria. So it will, if bacteria is there. So about the odor of the urine, it is, we call it slightly aromatic. So the odor also it will be changed according to this food that we are taking, and some disease also will alter the odor of the urine. يعني إذا كان الواحد ماكل حلبة أو شيء فيه حلبة تعرفوا الريحة كيف بتصير؟ So it will give some bad smell on the urine according to what we eat. So it depends upon the food that we are taking. Also, if we are taking drugs, the smell of the urine and the color of the urine, it might be changed due to the type of drug that we are taking and the food that we are taking. The normal pH, it is around 6, so it is slightly acidic, but also some type of food, it might change the acidity or the pH of the urine, and it might become alkaline. It depends upon the food that we are taking. So, and it will be slightly alkaline. The specific gravity of the urine, it is slightly more than the specific gravity of water. What's the normal specific gravity of distilled water? The specific gravity of distilled water, how much is it? Of distilled water. الماء المقطر كم كتاب النوعية تبعه؟ واحد. So it is 1. The specific gravity of the urine, it is slightly more than the specific gravity of water. Why? Why it is more? Because of the substances that, the minerals that it has, that and the electrolyte which is there. Sodium, potassium, urea, creatinine, all of those things, it will raise the specific gravity of the urine. So it is from 1.001 to 1.035 gram per cubic centimeter. The specific gravity, it is the unit of it, it is a gram per cubic centimeter. Solute normally found in the urine, mostly we will find sodium, potassium, urea, uric acid, creatinine, ammonia, bicarbonate ions. So those are the most common substances that present in the urine. So it is mostly water, and there in that water there is sodium, potassium, urea, uric acid, creatinine, ammonia, bicarbonate. So those are the main component of the urine. There are other components which might be there, but those are the main components. So, as we said, the urine contains water and waste. The waste which is there, urea, because when protein used for energy, the metabolism of protein, the end product of the one of the end product, it is the urine. The uric acid, it is from the metabolism of nucleic acid. So the nucleic acid, when it is metabolized in our body, the end result of it, it is uric acid. Creatinine, it is due to metabolism in muscular tissues. Iron and electrolyte depend on the hemostasis needed, and also drugs might, because drugs, it has to be metabolized in the body, and after that it is excreted. And the way of excretion might be excreted through the, some mainly from the kidney, but some also it might be excreted through the sweating, through our skin, some also through our respiratory system with the gas. Because of that, when we are taking drugs, sometime our odor, it will be changed. We can smell sometime the change in our odor due to the drug itself that we are taking. So it might change our odor of sweating. In the composition also of the urine should not contain the following. So the urine is free from red blood cells. Red blood cells should not be there. Protein also, it is not there. Glucose, bus. What is bus? When the bus is coming, when the bus is formed, when, when there is when there is infection. So it means that there should be no infection. If infection is there, if pus is there, it means the infection is there. Bile pigment also. If red blood cells is there, it is called hematuria. Hematuria, it means blood in the urine. Blood in the urine, it can be due to injury or due to some diseases, like in case of cancer. So, in case of cancer, sometime what will happen? It will invade the wall of the blood vessels, so leak of blood cells will be there. Protein, it is called proteinuria. It is happened in case of nephrotic syndrome. It's one of the disease of the kidney. Glucose, it is called glucoseuria. In which disease the glucose is coming with the urine? In case of diabetes. So, in case of uncontrolled diabetes, if the diabetes is controlled, blood sugar, it will not come in the urine. But if the glucose, if the diabetes is not uncontrolled, it means that it will reach over the renal threshold, the renal tolerance, the glomerulus tolerance of glucose. If pus is there, it is called pyuria. Pyuria. So pus in the urine. Bile pigment is there, it is bilirubinuria. From the bilirubin. So bilirubinuria. And in this case, the color of the urine, it will be dark yellowish. So this is about urine formation. In the next session, we will continue with the other parts of urinary system and how they are functioning. Did you understand how the urine is formulated and what is there, what is present there in the urine, and what's the thing that should not be there? And if it is there, it means that it is a disease condition. Any question that you have? Are you sure? Okay, thank you.